Gastal tablets is a combined antacid that reduces the hyperacidity of gastric juice and does not have a stimulating effect on the secretion of gastric juice. Aluminum hydroxide, magnesium carbonate gel, and magnesium hydroxide provide immediately after ingestion and long-term about 2 hours neutralization of gastric hydrochloric acid while maintaining acidity in the stomach at a physiological level. The drug Gastal inhibits the action of pepsin, lecithin, and bile acids, eliminates dyspeptic symptoms, enhances protective and regenerative processes in the gastric mucosa. Indications: dyspeptic phenomena such as discomfort or pain in the stomach, heartburn, sour irritation after errors in the diet, excessive consumption of alcohol, coffee, nicotine, etc. Dyspeptic symptoms such as discomfort or pain in the stomach, heartburn, acid belching, and their prevention resulting from the use of certain drugs, non-steroidal anti-inflammatory drugs, glucocorticosteroids, etc. Conditions accompanied by increased acid formation, gastric ulcer, gastritis, inflammation of the esophageal mucosa resulting from regular reflux of gastric contents into the esophagus. Hiatal hernia. If there is no improvement or if you feel worse after 14 days, you should consult a doctor. How to use? Always take this medicine in full accordance with the package leaflet or as recommended by a doctor or pharmacist. If in doubt, ask a doctor or pharmacist for advice. Dosing regimen. Adults weighing at least 50 kilograms. 1 to 2 tablets 4 to 6 times a day, approximately 1 hour before meals and at bedtime, but no more than 8 tablets per day. The duration of admission is not more than 2 weeks. Similar doses are recommended for the treatment of heartburn, regardless of food intake. Adults weighing less than 50 kilograms. The dose is half the recommended dose for adults and children over 12 years of age weighing at least 50 kilograms, 1 tablet 4 times a day. The duration of admission is no more than 2 weeks. Special patient groups. Patients with impaired renal function, dose adjustment is not required. The duration of admission is no more than 2 weeks. Use in children and adolescents. Children over 12 years of age with a body weight of at least 50 kilograms. The dosage regimen is similar to the dosage regimen for adults with a body weight of at least 50 kilograms. Similar doses are recommended for the treatment of heartburn, regardless of food intake. Children over 12 years of age weighing less than 50 kilograms. Children aged 6 to 12 years. Dosing regimen is similar to that for adults weighing less than 50 kilograms. Contraindications: allergy to salts of aluminum, magnesium, or any other components of the drug. Severe kidney failure, which is usually manifested by a significant increase in the level of creatinine in the blood and is called severe renal failure. Alzheimer's disease. Reduced concentration of phosphate in the blood. Lactose intolerance, deficiency in the intestinal mucosa of the lactase enzyme. Glucose-galactose malabsorption. A genetically determined malabsorption of glucose and galactose sugars in the intestine. Children aged up to 6 years. Precautions: talk to a doctor or pharmacist before taking Gastal. The recommended doses and duration of treatment should not be exceeded when used in patients with impaired renal function. In young children, the use of magnesium hydroxide can lead to elevated levels of magnesium in the body, especially if they have severe kidney disease or dehydration. Gastal is not intended for use in children under 6 years of age. If you have an intolerance to some sugars, call a doctor before taking this drug. Side effects: like all medicines, this medicine can cause side effects, although not everybody gets them. You should stop taking the drug in case of nausea, diarrhea, constipation, elevated levels of magnesium in the body, or seek medical help immediately in case of allergic reactions and pain in the abdomen. Rarely, not more than 1 person in 1,000, nausea, diarrhea, constipation, very rare, may affect up to 1 in 10,000 people. Allergic reactions, elevated levels of magnesium in the body, observed after prolonged use of magnesium hydroxide in patients with renal insufficiency, frequency unknown, pain in the abdomen.